Hi, and welcome to the Healthcare Uprising podcast. Today we have with us Katherine Van Tassel, the Director of Behavioral Health Consulting with GBS. Welcome to the show, Katherine.
Thanks for having me.
Great. So, Katherine is our resident expert on behavioral health, mental health in the benefits space. So, GBS is essentially a brokerage. And Katherine and I got connected through a previous employer of mine, Levitt Group, who GBS is a part of. So thanks, Haley, for connecting me and Katherine and having you on the show. And so today we're going to just quickly kind of high level cover some of the things around mental health benefits, behavioral health programs, et cetera, that employers offer. And that's really where Katherine's expertise sits. So with that, what can you tell us, like, as it comes to employers, since that's really where you're focused? Like, why do we need them? How has it changed? What's improved? Really, like, what are some of the best ones you've seen on the market? So just kind of high level to really get a good idea of kind of the purpose of them and what they aim to achieve and how do they benefit people?
Yeah, absolutely. I think a good way to look at it is all the opportunities that an employer may have in their workplace to address mental health. And really nice because when you look at that way, there are low cost, lower load strategies that you can take, and then also integrating with a mental health solution like a paid program, a third party vendor. And high level there, I always say one of the best things that you can do just initially is starting with the top down, meaning that C-suite, HR, leadership, anyone that's in a people leader position is trained in some sort of mental health um, like leadership training. So think mental health first aid and also suicide prevention. We really have to think about suicide as well in the workplace because there are many factors in the workplace that can lead to suicidal ideation. And of course, it's not something we want to have happen. So we can do trainings for leadership, people leaders. What do our policies look like? Internally, what is our access to mental health? So whether that's through the medical plan or then these mental health solutions that you're asking about specifically. So there are many on the market. And actually, during right around the end of the pandemic, maybe last quarter or last third to the end, I had been talking to somebody in that space and they said about 1,000 mental health solutions will come onto the market each year for employers. And I thought, how
Wow.
overwhelming is that for an employer? Like, where do you even start if there are
Hmm.
that many different options out there? It's really difficult. So that's really great when somebody works with their broker or somebody that's in that space to help delineate, like, what is a good option for me? Like, what is our industry? We know construction struggles with opioid use disorder, substance use disorder, mental health, suicide. Um, when you think about entertainment industry or hospitality, very high rates of substance use disorder. So that would be okay. We want to get a solution that has a good carve out would be maybe a word to use, but has a good internal solution wrapped up to do assessments for substance use disorder and then appropriate resources. So just thinking about a couple of options out there to give concrete examples. We have solutions like Spring Health and Headspace. Headspace actually teamed up with Ginger, which was a program that came out of MIT.
Ginger?
Headspace, yeah.
Oh, I haven't heard of that one.
Yeah, see, there's 1,000, so you can
There's so
keep up with
many, and
them
I thought I
all.
knew.
Yeah, yeah. And like CureLink, Uliance, I could go on and on and on. But essentially, if you want the Cliff Notes version, or just kind of like the cheat sheet of what you want to be looking for, think about how quickly do people access care? What is the way people access care? So can they do it through an app? Can they do it on a desktop? Can they speak to somebody, do that online? Are they able to filter through different therapists because might want to see a male and not a female. Somebody maybe want to see somebody with their ethnic background. Maybe they need to see them in the morning, in the evening. Essentially, we know people with mental health conditions get better as long as we reduce the barriers into getting help, and then we don't have long wait times. So, okay, how do people access care? Who are the people that are going to be treating them? Do we have good access and quick access to care? Is there some functional ability for people to choose a therapist? And if it's not a good fit, get a new therapist. And then subspecialty. What does this industry look like? What are the special needs that we have? And then does that platform support it?
Yeah. Every industry, like all industries are not made the same, right? So, and
Mm-mm.
I feel like this comes up to Jeremy. This is probably like ringing some bells. Like we've talked about this, and you even mentioned like construction, hospitality. We've done a series on ketamine therapy with a company called Enthea. Actually, Haley also connected me with them in doing ketamine therapy, highly prevalent industries like construction. They're getting in with like labor unions. So, like, and not all mental health apps and programs are the same, right? So they kind
Yeah.
of can have niche focus areas, I would imagine. I mean, I don't know all the ins and outs, but
It that's just 1,000 a year. Like how do you keep up with that? Like how do you know like what works for who? And like it almost seems like too much abundance going on there.
yeah.
Yeah. Yeah. I mean, that's my full-time job almost.
You're like,
Because
keep on coming with those products. You'll keep me employed.
That's yeah, that's a never-ending work. That's good job security. Your job's never going to go away if they keep coming out with 1,000 new things for you to check out every year.
Yeah.
the thing that I have to say about them is not all of them are good.
Mm,
And I think all of them have good intention. I believe that. But I think some of them try to be a little bit too niche. And the problem with being too niche is that if you bring in this product, then it's only going to speak to a fraction of your workplace. So I like solutions that have clinical and subclinical skills. So this may be another little tip when you're looking at a mental health solution is, okay, we talked about therapy, high level what you're looking for, but do they also have support for everybody in the workplace? Thinking meditations, maybe movement opportunities. So like you can go and do a 30-minute chair yoga or even cardio, again, speaking to everybody there. Do they have self-guided DBT or CBT exercises, sleep stories, thinking about all these different things that you can help. Also in the way that we live our life. How are we eating? How are we moving? How are we stressing our community? Having support there. And many of the good ones do.
do you think, and so there's a lot of stuff out there, and maybe this is thinking more in terms of like use of these types of programs, from your perspective, has there been a growing increase in the utilization of them by the employees? Like the employers make the decision, find, the right programs and whatnot. They implement them into place. They make, they offer them to their people. Are you seeing a higher utilization? Are we do people just not know what to do sometimes? I feel like a lot of people are confused about what their benefits are, about like, how do I use it? Is this actually for me? Or there's like apprehension or fear. Do you see that a lot?
Yeah, that's such a great question because there's so many factors within that. I mean, just one is how is the employer speaking to their employees about it and like constantly reminding them. And this is something I always talk to employers about is you have to remember how the brain operates. So essentially when we become stressed, overwhelmed, burned out, or have an untreated mental health condition, two parts of our brain downregulate. We go into that stressed fight or freeze response. And our frontal lobe, where we make good executive thinking, that's not working as well. And also in the back of our brain, our hippocampus, that's where we retain memory. That also kind of goes to sleep while we're in this stressed state. So the employer may have said a million times, hey, we have this EAP or we have Spring or Headspace or you name it. But at that moment, it's just like it's gone. Like there's nobody there in that part of the brain to bring that back. So the more times you talk about it, this is when I talk about having mental health champions, having a mental health Slack or Teams channel, having constant reminders is really helpful. The other part, and coming back to when I was saying, talking about training leadership, or having these mental health champions that have taken mental health first aid and can recognize common signs of mental health or stress or burnout, they can almost be this proxy frontal lobe. Hey, you seem really, really stressed. Have you called X solution? Because everything's really overwhelming. I mean, just think about if you've been underslept and overworked and have too many things to do. It's like one small thing that would normally be no big deal would just be completely overwhelming, or just like, I cannot do one more thing. So that person can be like, hey, let's just call and make an appointment for you to get in and talk to somebody. So thinking about having these types of initiatives, groups, plans, special interest groups within the workplace, this all can help drive utilization, because we know with like a basic EAP, maybe think about a free EAP through disability, we are getting like 1 to 4%. But if you have a more robust, then we see like 10, 14, maybe 20. And then again, we see that's industry specific as well.
Hmm. That's I've used EAP before, but there's been, you know,
EAP?
oh, what is EAP?
What does that
Oh, do
mean?
you want to? Oh,
Oh, you're
em-
asking me what is an EAP?
yeah, just to
Yeah.
spell it out for
Yeah.
those of us who don't
Employee
know.
assistance program.
Employee assistance program. Okay.
Yeah, like every benefit, it changes, right? Like I've had it it's typical, I feel like 6 free sessions. And at least in the past that was like in person, but now I'm sure it again, I haven't used EAP in a long time. I probably could have used it quite honestly. Now I'm thinking, shoot, somebody should really encourage me to get some therapy. And also
Mhm.
I should probably encourage my people, that are on my team. And I love that actually, as that's such a great leadership tip, honestly, for me as a manager of people to because I do have a full-time job. um, yeah, the podcast isn't my moneymaker. But
Thanks.
it is my joy maker. um,
I love that.
yeah, that's my therapy. I hang out with Jeremy and talk to really cool people.
It's a
um,
kind of therapy in itself.
it is, but like that's such a great idea though for me to think about. Like I should be more aware as a people manager what our
Mhm.
benefits are, so that if I see somebody on my team like stressing out, because I can tell you my boss has definitely seen me like, you know, hitting a wall. And
Mhm.
if somebody had said, you should maybe think about, doing this, or like we have the Calm app, like maybe go take a minute and, sometimes you need that push from the person that you report to, because then it's validating, right? Like they're saying it's okay, you
Mhm.
know?
And meditation in the workplace. You did mention that, and now you mentioned it again. So
Hmm.
I'll bring it up too. Meditation in the workplace can be a wonderful thing, and
Yeah.
really bring down those stress levels and enhance the cooperation amongst coworkers and all kinds of stuff. Can do
Yeah.
wonderful things.
Yeah. I'm all
Exactly.
Practice
for
And
sense
it.
this
anyway.
is, yeah, this is where education becomes so critical. Like, how are we getting this messaging across? Not even that we have this resource, but also what happens to your brain when you meditate. I mean, I have an hour presentation on that. We literally don't
Oh
have
well.
time to go into that. But thinking about, okay, if I'm an employer, I want somebody to not be, again, in this fight, flight, or freeze. I want them to not have foggy thinking or distracted or difficulty with concentration, which happens when we're in that response. And we know meditation, you're thinking about in minutes, like if you were to do box breathing, which they teach Navy SEALs, you go into that relaxed state, you're more focused, you can think clearly, be more productive. If it were me, I would want to give that to all my employees. But you don't know what you don't know, right? I mean, a lot of people are, how am I going to buy groceries this week and pay my bills? And I don't have somebody to watch my kids. Or, I mean, there's so much going on for people that we have to be there to help them as well.
This has been a Shut Up production.